Hello, and welcome to our expert panel. Are we digitally fit? The intersection between digital health and health informatics. My name is Dr. Jasmine Agnew. I am the program director for the Master of Science in Health Informatics program at Morehouse School of Medicine. Tonight, I am joined by three powerhouses in the industry: Ms. Janine Kane, Dr. Alicia Watson, Mr. Jamore Harrison. Just to give you some brief introductions, first, we are joined by an emerging health informatics professional, Mr. Harrison. Jamore Harrison is a data strategist from Montgomery, Alabama, and is now based in Atlanta, Georgia. He is a triple alumnus of the University of Alabama at Birmingham, holding degrees across disciplines like biology, biotechnology, IT, and informatics. He has earned certifications in PMP and the CPHIMS, which is a Certified Professional in Health Information Management Systems. He is a perpetual learner and is now pursuing his PhD in computer science and biomedical informatics at Emory University. His research revolves around data science, natural language processing, and informatics in healthcare. Mr. Harrison's professional experience includes large healthcare enterprises, local health systems, national agencies, and more. With a decade plus in IT, he's a data sleuth who has found his passion in healthcare IT. We also have with us tonight Miss Janine Kane, who is an icon in health informatics and data analytics. Janine Kane has over 12 years of a diverse experience in healthcare, spanning roles such as a data analyst, business analyst, product manager, and healthcare analyst. Leveraging her HIM background and analytic prowess, she has effectively tackled real world challenges across various domains. Pursuing her passion for data driven solutions, she earned a Master of Science in Data Analytics, setting her sights on becoming a data scientist. With a solid foundation in HIM and RHIA certification, a Master of Science in Health Informatics, and a Certified Professional in Health Informatics certification, Kane is committed to enhancing operational efficiency and product innovation through collaborative efforts and data analytics. Her vision extends to championing patient rights and health information usage, advocating for consistent governance and transparent application across the healthcare spectrum. She is currently employed with Centene as a data analyst and serves as a healthcare advocate. She was formerly a Speaker of the House and worked in patient advocacy for health information management. And finally, we are blessed with the presence of an educator in the field of health information management in the person of Dr. Alicia Watts. Dr. Watts is currently an assistant professor for the Health Information Management program at William Carey University. She has also helped to develop the launch of the Master of Science in Health Informatics and Information Management program. Prior to taking on her role as assistant professor, she worked in the field in HIM roles such as a record index specialist, EPIC certified clinical analyst, adjunct professor, and clinical research coordinator. She's a proud graduate of William Carey University, where she received her Bachelor of Science in Health Information Management, her Master of Business Administration, and her Doctor of Philosophy degree in Health Administration and Education. Her previous experience and educational background have allowed her to become well versed in information governance, health informatics, leadership, regulatory compliance, privacy, and security. She's an active member of HEMA and the component state organization of the Mississippi Health Information Management Association. Welcome to you all. It is so great to have you all here on the panel. And just to tell you, just to let me just share with our attendees how all of this comes full circle. I'm from Mississippi. So of course, Dr. Watts will be here to represent my home state. You may not see it, but I have the whole state of Mississippi tattooed on my arm. I love my home state. I'm an alumnus of the University of Alabama at Birmingham, which Ms. Kane and Mr. Harrison both graduated from, and former employer of Western Governors, which Ms. Kane also graduated from. So we are connected on so many levels, and it is so great to have you all here to serve as industry experts as we talk about digital fitness in healthcare. So since the late 1990s actually, inequalities in tech adoption have been characterized as the digital divide. Now, the technology adoption discussion looks at people's preparedness, such as their digital skills and trust in technology, which may influence the use of digital tools, separate their access from to them, and the term is often used to capture this is digital readiness. And so that's what we're going to talk about tonight. When organizations think about digital readiness, it's usually about whether or not people have the skills that they need to be able to use this technology to improve patient outcomes and to improve literacy among their patients, and to determine whether the information that is shared is actually trustworthy. So tonight we're going to discuss the readiness for emerging technologies by providing access to patient information and then using those technologies to improve the patient outcomes. We'll examine readiness from the workforce development and academic perspective, as well as those working in the field as emerging technologists, as well as those that have been in the field for quite some time. So tonight, I'm going to start with you, Ms. Kane. Got a question. Our first question is, what has been your observation regarding industry readiness to implement the use of digital health platforms to improve patient outcomes?
Well, I mean, I think readiness looks different for different people, right? Or different settings, different organizations. And I think that's where the struggle really resides because you have different at different stages, you have different amount of resources. And, I mean, we're still combating 100-year-old paper processes that we're trying to fit the square peg in the round hole. And, I mean, as technology and innovation continues to propel forward, we're kind of stuck in like what we can do or what we can't do, what we can capture, because we're so focused on data elements and capturing things and making complex workflows, which bog down and increase the administrative burden. So, I mean, I think like no matter if we implement these digital solutions, like the readiness, I mean, to really be able to utilize it is really a challenge.
Okay. Ms. Harrison, same question. What has been your observation regarding industry readiness?
Yeah, so first I want to say thank you for having me, Dr. Agnew. I'm
Thank
glad to be here with my other fellow panelists. I would say we can answer this question two ways. In terms of the people, I think the people of the organizations, the healthcare organizations, are ready. We know that because there's money being poured in digital health, all the buzzwords, data science, data analytics, all the buzzwords have money behind them, whether that's on the federal level, local level, there's grants, there's money there. In most cases, I'll say there are some cases where it isn't. But in terms of the structure, I don't think we're ready. And that's where it gets a little iffy. So the structure, I say that in terms of interoperability, in terms of the exchange of data, in terms of legacy systems at these healthcare organizations, are they ready to be set up for new technologies, digital health technologies, digital health platforms?
And one of the things that when we think about that readiness, depending on the size and like you said, the money that's available is how ready they are, because some places they just don't have the funding to pour into becoming ready. Some of them don't want to pour into becoming ready, and then some of them are ready to move forward. So it really just depends on where you are, geographic locations, the availability of the funding, and I guess just the readiness of the people. I think that's where it's important that not only we have the skill set for understanding digital readiness, but change management as well. I'm a pro-sci change practitioner, so change management is at the top of my list, because you can have the best laid plans, you can have the greatest ideas, but if you don't get your people on board, they're not going to be okay with the adoption of even the things that'll help get them ready. So just kind of switching gears, I want to talk about this from an academic perspective, because our students that we're training to become a part of the workforce, they need to understand these difficulties and these intricacies of digital readiness as well. So Dr. Watts, when we think about digital health, how it impacts health and informatics, how have you made curriculum changes to address and to meet these industry needs?
Right. So, according to the definition from the National Institutes of Health, digital health is the use of information and communication technologies in medicine to promote healthcare. So this is going to include our wearables, like our Apple Watches, Fitbits, things like that, mobile health, telehealth, health information technologies, all of that. So we want to make our students aware of these topics prior to getting into the field. So in our curriculum, we not only like to make our students aware of these topics, but we also like to get our students to immerse themselves in these topics. So for me personally, I like to use relevant case studies. So I like to put my students in a position where they have to implement something, or they have to train end users, or they have to convince someone of the importance of these technologies. So as we try to make these case studies relevant, we try to include things like telehealth or patient portals or other digital health applications. We also like to make sure our textbooks are up to date, because we know how easy it is to fall behind in education, because our books usually can't keep up with the rapid changes that are occurring in healthcare. Mm-hmm. So we do what we can to keep our students ahead of the learning curve. So for me personally, to try to curtail that education lag, I like to provide my students with relevant articles that are related to, mobile health or telehealth or something like that, so that they'll feel empowered to know that they're learning relevant information that they can take out into the field with them. And just so that they know that they are getting the necessary knowledge, skills, and abilities that they need to excel once they get into the field.
And that's one of the things that's always been very important for me, especially when it comes to competency-based education. All of us can probably talk about what we learned in the textbook when we were in school. But when we went to work, none of that stuff that happened in the textbook was really what happened in the department. Especially now, I know all of us we'll probably date ourselves, but we're all older than Jamar or Mo, as I call him. We're older than Mo. But I can tell you about those paper days when you try to tell the doctor, hey, you cannot see any more patients until you get these records signed and get up to date on all your discharge summaries. And then the next thing you know, and not only is he throwing a fit, but he may be throwing that paper across the room, and you got to duck and get down. Like, that's never been in our textbook. We also don't talk about how, we talk about in the textbook. I remember back when hybrid records became a thing, when they were talking about barcode scanning, the difference in a QR and the barcode, and that you can get this Kodak scanner and it would scan 30 pages and it would increase productivity. Let me tell you something. There were times when you might get 10 pages in there. You might. And you won't have to stop it. And you got to pull the cover down. You got to pull them out. You got to straighten them out. And somebody's got their sticky peanut butter and jelly hands, or their coffee cup stains, or something. For me, it was so important for students to understand that the world was so much bigger than what was in a textbook. I wanted them to read about these real world events, the scenario-based learning based on what was really going on in the field, aside from what they just, the book is a great foundation. The articles, that's where your meat is. That's where you get the real right now. We talk about data breaches. I could talk about data breaches back in the day, but we've already had data breaches in 2024. They were on LinkedIn and on the news the other day. Let's talk about the right now and how we can find solutions for what's going on right now. So I love that type thing, especially when it comes to students and preparing them for the workforce. So next question. We'll stay with you, Dr. Watts. Who are your major stakeholders of digital health readiness when it comes to academic programs, and how do you get them on board and engaged as we prepare our students?
Right. So one major stakeholder, of course, is our accreditors, because they provide our programs with the standards and guidelines that we have to meet to ensure that our curriculum remains relevant and up to date. And accrediting bodies, they hold our educational programs accountable to ensure that we are adequately preparing our students to take on these roles. Mm-hmm. However, I believe that the most important stakeholders are going to be our community of interest. So that's going to include our industry partners, our health informatics leaders in the community, former students. So in education, we have advisory committees. So these committees are extremely important because it includes those individuals I just listed. So it's going to be our HIM directors, our managers, our coders, other educational program directors,
Mm-hmm.
and recent graduates. So the feedback from these individuals is crucial because it provides us with a sneak peek into what's going on in the field, and it gives our industry partners free reign to tell us what we can focus on in our curriculum to better prepare our students to step into these future roles. But that's easier said than done because as y'all know, field practitioners are busy.
Yeah.
So it's hard to get them to take on an additional role, especially a volunteer role. It's going to take up a little time. So what we've learned, the best way to get these individuals on board is by building relationships. So that's when we go to our state conferences and our national conferences and just start building those relationships and network to try to, get these individuals engaged and, just having that ongoing communication and keeping them updated about changes in our curriculum and accrediting standards and our student success rates.
All right. So that's let me segue from your question and let me ask Mo. Mo Jamore, Mr. Harrison. Um, so when you think about your experience in the field, I know you have a really unique situation to where you were working in the field for a while. You've been working in the field for a while, even as a new graduate. Was it difficult for you to find a field practitioner that would say, "Hey, come and let's do some work," or we have an opportunity for you here as an intern when you were in school? Because I know I do have some of my students, I think, that have logged on to the session, and that's one of the struggles that they face is finding that practitioner or finding that organization that will allow them to come and get that time as an intern. So what was your experience with that?
Yeah, that's a great question. I would say I'm also give a little advice as I say it though. It's not just going to fall in your lap. They're not just going to find you. It's really the big thing because I mean they could pick a name out of a hat and find somebody they could help. But what really stands out is when you are networking, when you're going to the events or you're talking to your program director, whoever else, a school official that can connect you to these people, the practitioners, the alums of that program, and just networking, letting them know, hey, I'm interested. Do you have anything that may be relevant to what I want to do, or something that is not relevant, but I can use that as transferable skills into something that I want to do later down the line. So it was, I would say, hard, even to this day when I'm still helping others, where I'm either mentoring them directly or connecting them with a mentor. I think it is still hard because there's many more students out there that are looking for a mentor than there are mentors looking for mentees. So I think it is a hard feat, but it stands out when you are trying to be known or network or just let them know that you are there and willing to be mentee.
Mm-hmm. And now they have, when students are not able to get those in person or even those remote internships, they have those virtual internships. I've been trying to introduce my students to some of those, and really those are skill building where, it gives you a project, you work on that project, and then you add it to a portfolio to show either your future preceptor or even a future employer some of the skills that you learn independently. I Hey, whatever you need to do to get it, sometimes you have to build it yourself. You have to do
Yeah,
it yourself.
truly, I agree. And then also those same internships could be, with some of your bigger companies that are, on LinkedIn 24/7. Hey,
Mm-hmm.
I'm hiring an intern. There may be zero inquiries on that internship, but you could be the one. Hey, I'm interested. This has nothing to do with what I want to do in the future, but I know it can give me some type of experience in this field. So
Right.
therefore, I'm going to try it. Yeah.
And even if it's like I send out a list and it may have compliance, it may be supply chain, it may be how do we utilize what we learn as far as project management, system development, life cycle, all of those skills that you learn in our health informatics programs and apply them there, then you can take that with you. Those are transferable skills you can use across industries. I have a really good friend. She has a degree in health informatics, but she worked in project management for a trucking company with a degree in health informatics. And it's because of her understanding of project life cycle and project management. So always opportunities. So while I'm with you, I'm going to change gears a little bit, ask you a question. So digital health platforms are designed to improve and support healthcare delivery. However, there are barriers to not only implementation, but facilitation. How do we overcome?
So I think to start that one off is to talk about the barriers that are present in the field for implementation and facilitation. And you actually mentioned one. I would say, well, I think a couple of us mentioned one, but the one that's sticking out to me currently is privacy and security. We've already had a huge data breach in the year of 2024, and we just hit the third month.
Already.
So that's one of our biggest barriers that we have to realize in the field. But also we can think about regulations. So on the federal level, when we're thinking about health policies, policy reform, things like that are also barriers when it comes to implementation. Are we really enticing these digital platform vendors, things like that, to even want to implement in the healthcare? Because truthfully, there's more money in the private sector. So therefore, as a vendor and as a CEO or whoever I may be of a company, I'm going to go for the private sector. So what incentives do we have for them to come to the healthcare side and really innovate in this space? That's a big barrier. And then also going back to something I mentioned earlier, what's interoperability? Mm-hmm. Are these platforms going to play nice with the ones that are already in place? That's one of the biggest things, because implementation is not an easy task. It's also not a cheap task when in a healthcare system, no matter how big or how small it is. So interoperability is also a huge barrier, I would think.
Ms. Kane, I want to ask you the same question. What are our barriers and how do we overcome?
Well, a lot of times it's the solution itself that's a barrier. Because I know when I worked in implementation, I would have to work long hours to, try and retrofit something into a facility, because each facility is different. But, I also think it's the $1 million question, right? Because, somebody makes an ask, somebody develops a solution, we go to implement it, and it does it really solve the problem? I don't think there's appropriate metrics around there. Like if you look at, the CMS data and then the EHR data collected by healthit.gov, and you look at the overall quality scores, there aren't any consistencies there that you can find. And our solution is always like, well, we need more data, like to be able to understand things, but are we collecting the right things? Because we always will have those challenges and those constraints of time, resources, budgets, but what are we trading off? Like, are we trying to solve that one ask instead of defining the problems, redefining like how we actually do those processes and deal with people? Because you can't solve for human behavior, right? If somebody wants to achieve something, they're always going to find a way around it, which means that then your data is messed up because you're not going to be able to analyze it. And data can tell any story. And that's what I tell everybody all the time. Data can tell any story you want it to, especially if you don't understand it. If you go from an insurance environment to an inpatient setting, you're going to have your preconceived notions on what it should look like, and you're going to miss something, or you might not understand the manual processes that still exist, between the things that are collected. So you're missing a huge gap of information. And so like, instead of closing the gaps, I think we're actually increasing them. So we have more barriers now than we did before. And so I think, what we're going to need to do is like have more collaboration and cross training into different disciplines, not just isolating and silo discipline, because we all have our strengths. And I think that we need to like work on building communities in order to have that feedback loop, including even patients, right? Because we're stakeholders in every single facet of healthcare. I mean, if we're not the patient, then we're, helping to manage the information, or we're running a project, or, doing data analytics. But we have to find a way to get everybody into that viewpoint. So we're not just having a one-dimensional solution, and, what's working for one person isn't working for the next. So, I think like barriers, we need to get back to the basics and figure out like what are our problems, and what do we really need to solve. And if it's like, advocating to change the existing laws that are, keeping all of those documentation, like just so like the data elements that are creating physician burnout, and, because it's a ripple effect, and we need to control the ripples and make healthcare better and more usable, because we're not, no matter how much you educate somebody, is it really going to change the existing structure?
And I think about, and this is me and my cogwheels. We create these digital health platforms. We use these digital health platforms, we implement them. We give them to consumers, consumer health informatics. We put in these wonderful programs to collect data from that patient so that we can monitor their conditions and monitor what goes on with them, whether it's done in our office, or whether it's even something that they do at the house, whether it's something they transmit from their wearable. I think about, what if they don't hook the wearable up and it doesn't transmit? What if they don't go in and type and enter their information, or they don't enter it properly? Because let me tell you something. When it came to my doctor telling me to manage my blood pressure every day, I had the same blood pressure every day for about 3 weeks. Why? Because I didn't check it. I didn't want to check it. I didn't remember. Don't sue me. Don't hurt me. But I'm just telling you, I'm not the only patient that does that. So there's no way to ensure that you're consistent or there's truth in reporting. Sometimes I don't even tell you if my blood pressure is high, because I don't want you to put me on any additional medicine. I don't tell you if my blood pressure is high or my blood sugar is high. So whatever I'm putting into this digital platform, garbage in, garbage out, you don't know if I'm telling the truth or not. So that means that the data that you're collecting in this digital platform, it may not even be useful when it comes to providing effective treatment and improving patient outcomes, because the input is wrong. It's like a hamster wheel. How do we ensure, when it comes to digital fitness, that there isn't, how could we ever, like you said, we can't really control human behavior. You can't make Jasmine do anything she does not want to do. Okay. So how do we manage the Jasmines of the world that I have to put my weight in every day. And some days I stand on the scale. Some days I don't. Some days I don't even turn the Bluetooth on to get the accurate scales on until it goes up too high. And I'm like, wait a minute, let me turn it on to get the right measure. So how do we control the patients that, when it comes to digital fitness, it's not because we don't have the platform in place. It's not because it's not set up. It's because our patients don't understand the importance of healthcare literacy or the truth in their reporting to make sure that we can even give them improved patient care and can see an improvement in patient outcomes. How do you manage the Jasmines of the world? We should copyright that, the Jasmines of healthcare. But how do we manage the Jasmines of the world?
I think that's a hard question, because they've been trying to do research studies for years, and some of the outcomes, they have to throw out, questioning the validity of some patients. Because you can't always account for everything, and you can't account that because of human behavior, right? Like the doctor is going to put down a diagnosis so you can have a test sometimes, or what about the misdiagnosis? The variables go on and on, but I think like the biggest thing is trying to, for me, I think it is trying to build that trust, right? It's building that I'm not going to ask you the same question every time I go see the provider every time, or will tell me why you're here when I've already put in my chief complaint before going in. I think there is a real question whether, healthcare does have a certain and I hate the word to use competence, but that's the only word that comes to mind, right? You know, like we can't trust that we are getting the care that we need to. I mean, there's a lot of emphasis on checklist, and there's a lot of emphasis on, quality measures and these things, but we know that the denominator can give like, a incorrect guideline or output based off of the person,
Yeah.
and because everybody's different. And so I think like it's going back to the basics and reconnecting with patients and letting them drive healthcare and not letting companies drive, or something that's not related to making sure that we are improving everyone's right to healthcare and equitable, and making sure that it is valuable for that person and not for a statistic.
I can add just one thing, and I'm probably not going to be politically correct when I say it because it's an old country way to say it, but it's saying that you can't help anybody more than they want to be helped.
That's true.
So I say that to back up Mrs. Kane, I'm sorry, is we can innovate the best technology and implement it to zero fault in the healthcare system. But if the patient does not want to be helped, or the patient does not see the value in whatever we are doing, it dang nigger defeats the purpose. So that's what we're trying to say here. So we really have to go back to, like Mrs. Kane said, it's letting the patient drive what they need. I can't remember the name of it. I can look it up soon, but this new way of implementing healthcare, how it will be transformed patient-centric, I believe is where it's going. But just patient-centric, it centers around the patient, allowing them to drive what is going on, the situation, the diagnosis, all these things. So I think that's the way that we should be moving in terms of our innovation, in terms of our planning, everything in the healthcare realm.
Yeah, stop asking me my weight every day, because I don't want to go stand on the scale every day. Mhm. Dr. Weiss, did you have something?
Right. I just wanted to piggyback on what they said. I mean, these type tools, I feel like it's best for those patients who actually, who want to use it. For trying to force somebody to use it who isn't even interested in it, or somebody, like I said, who don't want to get on the scale every day, is pointless. But those who actually want to do the work, those who want to, improve, that's who this is. This should be targeted at. That's all I wanted to add.
Yeah, because fitness is both ways. It's bi-directional. Like you said, you can have the best system, but if your patient is not complying, you won't be able to capture what you need and fully use, your digital platforms. Awesome, awesome. All right. So I asked about stakeholders for academics, but what about the major stakeholders of digital health readiness when it comes to evolving healthcare ecosystems? How do we get them on board and engaged as we prepare our providers and patients for a change? Even the jasmines of healthcare that are not always compliant sometimes. How do we get them on board and convince them that digital health platforms are the way to go? Generative AI, add that to it. How do we convince them that this is what we need to do?
Who's going first? I guess I can just go. I just think that like we're all stakeholders. So I think we need to, as we all play multiple roles in the healthcare ecosystem, I think we need to start allowing for a better feedback loop on what's working, what's not, build that community, start building it up, inviting patients, providers, the HIM professionals, HI professionals, data scientists. I think they all need to learn to work in a together in a feedback loop to where we can improve it. Because, what happens? We need to let patients have access to their healthcare. Now we all have like at minimum 6 patient portals that we get to log into to see our information. Now, who does that, right? Like, I mean, I don't remember what's in what system. I mean, I just, do what I need to do. I'm like, I'll sign my release form and get the information over there. But, I mean, outside of my job, I'm not going to be a health information manager. I mean, but we need to like start thinking about different ways to gather information, build that community so we can make a more inclusive healthcare system that's right for everyone, not right for the median or mean person, the average. And we can't just put one weight on a discipline of thinking that they know, because as we all have experienced, you move one position over in healthcare, you move to a different setting, it is like learning a whole new job. And that's what I don't think people understand, that it's not like a 1 + 1 = 2. It's like a 1 + 1 = 5. So it's like healthcare math. I mean, I haven't really seen a lot of those TikToks, but I think somebody really needs to put that together, because I don't think people really understand, if you haven't transferred outside of a role, how different it is.
Mm-hmm. Absolutely. Mr. Harrison, same question. How do we get them on board?
So I want to first kind of list, like Mrs. Kane said, we all are stakeholders.
Mm-hmm.
But specifically, I want to highlight, I think I mentioned it earlier, was the federal government. That's one. And then also payers. So insurance companies, I think, are two big stakeholders in terms of digital health readiness. Federal government has a very unique position where they can incentivize. They can, in terms of supportive policies, reimbursement models, things like that, that can really incentivize the vendors, incentivize the payers, and honestly incentivize us as well too, as the providers and the patients. So I think starting with some supportive policies that are inclusive, equitable, and then also, I mean, just they look good on paper instead of it looks like a lose-lose situation right now. So instead of that, we could, look for some policies that could be helpful in terms of readying that field. So also, I would say, how do we get them on board? So we already talked about the payers in terms of supportive policies that will help them, but also in the patients, I think we can go back to what we've already mentioned in terms of literacy and education. It's teaching these patients, sharing the knowledge of why this will be useful. It goes back to, honestly, all the questions that we have answered is, if they don't see the value in it, it has no value. So we have to share that value and have to kind of highlight why it's valuable to them and not just us as the system, the healthcare organization, the government, whoever.
Now, I want to go back to Dr. Watson. I know, Dr. Watson, before you transitioned into academia, you were an Epic HIM analyst. I was too. And so I remember the struggles, the things that we went through trying to get those systems implemented. So I want to ask you the same question. From what you remember, and during your time as a practitioner and working in the field, who were your stakeholders? How did you get those people ready? The facilities, because some hospitals in Mississippi were ready. UMC, some of the largest, I guess Forest General, I don't know, down in Hattiesburg, maybe they were ready. But then you got some other hospitals that just weren't. How did you get them ready? How did you get them on board?
Right. I have to add that, another stakeholder, of course, is going to be our providers. I worked at a provider-owned clinic. Okay. So, they controlled what happened and what didn't happen. So it was mainly getting those providers, those physicians on board. And we all know that can be difficult because they typically don't like change. So just trying to show them the value of these implementations, that was more of our struggle. So just showing them that this is going to be a tool for you. This is something that's going to help you and not hinder you. That was our main stakeholder.
And when we think about technology can be a benefit. Now, of course, there's a learning curve. There are some people that are just not okay with it, but it does improve And we've seen the improvements that come with implementing this new technology, but there's still some difficulty even now in 2024 in getting people to buy in and being on board with digital health and digital technology, emerging technology. I was at a campus last weekend. We were talking about the use of AI in medical education and how it augments medical practice. But in their mind, they say, okay, this is going to take away my ability to do my job. They're going to have this machine doing my job. And I said, no, it's going to improve your ability to make decisions because it'll see some things that you won't be able to see because you're not looking at the bed to see a patient restless and moving from side to side and they can't get content, they can't get settled, and you won't be able to tell that the body temperature is spiked or their blood pressure has spiked, but this machine will, and it'll be able to put it in the system, and then you'll be alerted, and then you won't have to have a patient care tech in there every minute or every hour taking blood pressure. You've got AI and tools that you're using. You'll have natural language processing. You'll have other tools that you can use that'll make your job better, but it's not trying to take away. That human touch is always needed. But I think that one of the things that we struggle with is helping people to understand the benefit of the digital health and any of the emerging technologies and look at it as a way to improve what we do and not take away your job, not take away your job and your function. We're not going to take away your job. And, health informatics, health information, especially, thinking about health information management, a lot of people started thinking that way when you date back all the way to encoders. You remember when people started learning how to code on encoders? They were just like, oh my God, we're not going to. Look, an encoder is not here to take your job. 3M is just trying to help you because you're finding the wrong thing in this book half the time. Then we went to computer assisted coding. Then, as things evolve, it gives you more opportunity. It gives you a more diverse set of things that you need to learn to do your job. It's not taking away your job. But, that goes back to people and their readiness. So I think that when it comes to fitness, yes, the platforms are important, but it also is important to look at the people and the people in the processes. Last question. Well, it's not the last question. My question for Dr. Watts. Looking toward the future, in what ways do you anticipate digital health advancements shaping the future of health informatics practices, and what steps are being taken to stay ahead of the emerging trends in this intersection? Oh, that is our last question.
Well, as health informatics evolves, the possibilities are endless as it relates to digital health. And as us as patients or healthcare consumers, as we become more empowered to take our health into our own hands, those who want to take our health into our own hands, we can certainly expect a boom or a significant increase in the use of these digital health applications. I believe we can anticipate providers and healthcare organizations being more open to integrating data from health applications into electronic health record systems when we can, look at it to make sure that it's quality data, of course. And, remote monitoring is happening now. Glucose monitoring, that's happening now. Mm-hmm. And I believe that remote monitoring will become a standard and not just an option in the future. However, there are challenges with making this future a reality because, like I said, provider skepticism. Like most of the providers, they don't believe in it. They don't want to use it. But if we can make our providers aware of these tools and the possibilities, we have to make sure that our providers and our healthcare organization, our C-suite are all aware that these tools are here to assist and not hinder, to make jobs easier and not harder, to assist in that decision-making process and to provide a means of effective and efficient care for our patients. And though that's what's most important, making sure our patients are taken care of.
Right. Ms. Kane, how do we stay ahead?
Well, I think, not jumping leaps ahead of where we currently are. Because you can talk about AI and solving problems, but is it really? Because in a lot of places it creates more work, it creates more adverse events, because it's not appropriately used for what it can, and especially in healthcare, because it constantly contradicts itself. There's not clean data, and it overlaps. And so it's constantly competing. So whether you're doing supervised or unsupervised learning, you're always going to have that. I mean, that's why we don't have computer assisted coding, and everybody's like, oh, the coding's not accurate. Well, no, it's not the coding. It is the underlying data, the structure, how we're collecting it, what we're doing, what patients are willing to give in order to, allow providers to make the right decisions. For coverage, you go back to, when you're talking about payers and the reimbursement and medical policies being created. If we start applying systems and digitally for where we currently are, I know we need to get there, but we also need to make sure that we're back to the basics. I can't say that enough, because we can try, but we're just kind of trying to mask things until it blows up somewhere else for us to uncover another problem that we need to solve for. And, I just think that we need to make sure that we're not putting AI or any type of solution like that in a decision making, because ultimately humans, they get fatigued, they get focused, distracted. So anything to help them focus on something, or like radiology, where people can read that wrong once they get tired, or they're not exposed to seeing something, right? Because as humans, we learn things, we trend into like what we're exposed to, and that's how we learn, and grow. And like those are the types of things where we need to focus on and making sure. But I think we need to advance in parallel and not like leave a man behind, which we're leaving all of our important things behind in order to advance technology.
On the next episode of Expert Panels, Dr. Agnew and Ms. Kane are going to go head to head about the importance and the use of AI in hospitals. We are on 2 different pages, but we're going to get on the phone later. We're going to talk about it.
Challenge accepted.
Mr. Harrison, how do we stay ahead?
So I'm going to preface my answer saying my research interest is in maternal mortality and opioid use disorders using language processing, which is a subset of artificial intelligence, AI. So selfishly, I say that I think NLP is going to be the biggest thing to impact healthcare in the recent years, and then also in the future. I think NLP is where we're really going to get the most data out of all the clinical data that we have. So, I mean, it's the only thing that can really search through clinical notes. And that's where tons and tons of data and data elements are housed. It's in the clinical notes. And that's why also healthcare data is the most intricate. It's the most nuanced. It has the most issues with it because it's free text. It's nothing but free text. We have this much in, structured databases and this much in free text. So when we're using something like the AI platform or NLP, that's where we're going to get our data from, and that's where we're going to get the most use from in health informatics. So,
okay, you can come to the battle too. Come on.
Thank you.
We'll talk about it. All right, Blake, do we have any questions in our from our viewers? Any questions in our chat? Is our producer gone? She's here. Oh, okay. All right. Well, I thank you all for coming. Does anybody have any questions? Any questions for any of us here?
I don't. Thank you so much for putting this together. I enjoyed it.
I know. I love it. I love this type of stuff. I tell you,
Yes, thank you for the invite.
Yeah, we're going to do this about once a quarter. The next one, we're going to talk about AI.
I'm excited.
I don't know. I just think that, AI is going to be one of those things where we're going to see a lot of, let me preface, but let me back this up. There was a lot of fear behind when AI was first introduced because people were afraid of what it would mean and what they would lose. But I think that once we see some of the benefits, it's just like everything else when it comes to digital health. It's just like it was when it came to EHR. When people understand the benefit, maybe then we'll be able to move forward with it. Now, do I think that we need to just do a big bang implementation everywhere? Absolutely not. Absolutely not. But do I think that we do need to, number one, start training our healthcare providers if that's the direction where we're going in healthcare in general? And not just our physicians, but all clinicians and all healthcare people that are involved in the healthcare team? Yes. But I also think that on the administrative side, we need to know about it too. But I do think that there are some benefits and some benefits that we don't always look at and think about. Linguistics, when it comes to natural language processing, of course, that's going to be an issue. Because what I say, being from Baldwin, Mississippi, may sound different than what Janine says, being from Louisiana. You know what? You're from Louisiana. Yeah.
I am. I
Yeah. So that's what I'm saying. Linguistics will be an issue, but that's why we have people like Mo that do research to look at that by the bias in the algorithms and how we can fix these things. So I don't know. We're gonna get it together. All right. Well, we do not have any questions, so I'm going to give you all some time back in your day. But thank you all for being so gracious as to come and to be with us tonight on our expert panel. Please, those that are watching, visit msm.edu/online to learn more about our Master of Science in Health Informatics program. Early decision deadline for entry into the program for this fall is on April the 5th. I am Dr. Agnew, Program Director, and would love to have you here at the house. So, y'all have a wonderful day, and we will see you again next time. Thank you.
Thank you, everyone.
Thank you.